In this lecture, we'll be discussing the purposes and benefits of treatment planning. Treatment planning is an essential therapeutic activity. You'll start with your case conceptualization, where you're formulating your understanding of your client's situation from a given theoretical perspective. Then you'll move on to constructing your treatment goals, as we discussed last week, and then you'll begin selecting the most appropriate interventions to help your client meet their goals. And remember that your treatment plan will be initiated after a comprehensive client assessment. And that assessment should include not only, administering whatever standardized measures you are to your client, going through the clinical interview, but also you'll assess the client for strengths and resources. You will assign a diagnosis if appropriate, and then you'll identify available services and resources. So what should your treatment plan contain? It specifies the change interventions, so the type of treatment that you'll use to help your client reach their stated goals. And this will depend on your theoretical perspective. So if you're working from a psychoanalytic perspective, your interventions might be dream analysis, analysis of transference and resistance. If you're working from a behavioral perspective, it may be something like exposure therapy, response prevention. From a cognitive behavioral perspective, it may be something like thought restructuring. But whatever the type of intervention is, it will be aimed at helping your client achieve their goals. You also have to specify the specific format or way in which that intervention will be delivered. So that will be your mode of treatment. That could be individual, couples, group, family, whatever particular type of mode of delivery you choose. You also outline the activities the client will engage in to realize their goals. So we call this the client implementation. So will your client have to do homework? They may have to do behavioral experiments, for example, going out and approaching people to start conversations if they have social phobia. So here you're outlining exactly what your client will be responsible for during the course of treatment. You also discuss your prognosis, which is your prediction for how likely the client is to meet their goals. And then you'll discuss the frequency and duration of your services. How often we meet with the client, for how long, and then how long do you expect to meet with the client in terms of number of visits. So treatment planning is not a discrete activity that occurs at one point in time. It's a continuous process. So your plan will continually be revised. Some reasons for having to revise your plan: you could get new information about the client. The service delivery setting could change, or the types of available services could be altered or disrupted. Maybe you had somebody who you work with who provided a certain service and that person is no longer available. Maybe there is a change to your client's insurance that no longer covers certain services that had been covered in the past. So those types of things would require a change in your treatment plan. The plan could also be revised if there is an impasse in the client-helper relationship. So if there's some type of breakdown in that therapeutic relationship, you may have to revise your plan, go back, focus more on relationship building, and change the pace at which you're trying to achieve their goals. So what are some of the common factors in facilitating change? What, regardless of your theoretical orientation, are the things that generally help clients reach their goals and bring about change? So 40% of client change can be attributed to client characteristics. So these are characteristics that your client brings into therapy. Things like their personality, their culture, their support system, their typical coping strategies, their readiness for change. So these client characteristics account for about 40% of the change in therapy. The quality of the therapeutic relationship between the helper and the client accounts for about 30% of change. 15% of change can be explained by the therapist's hope and expectancy. So your belief that the client has the hope of change or is able to change accounts for 15% of their actual change. And then finally, the particular techniques that you use account for about 15% of that change.